What is the cartilage? Where does it exist? What is the importance of cartilage? Cartilage is the soft bone lies in between the two bones in the joint. Cartilage is the major source of movement of the joint. It really helps to make your joint movement smoother, and it helps you to do much more activities during your life. Cartilage is the cells, it has a cartilaginous cells which are soft tissue cells which helps you to maintain the joint structure and then its functional ability. So what exactly happens? As it is, we know it acts like a shock absorber to the joint. When you act upon your joint, when you jump, walk, or does lot of sports activities, there will be compression between two bones in the joint. In that situation, this cartilage will act like a shock absorber to help you to go in smoother way, and then it will not allow to damage the both bone ends. So obviously this cartilage is the most important structure in the joint where we need to take care of it. So a lot of people get injured this cartilage due to various sports activities or road traffic accidents or any other things. So when you want to diagnose this cartilage, the best source of diagnosing the cartilage is to do a MRI. That is the best way. In MRI we can rule out the cartilage injury. So when MRI can rule out even 1.1 mm of cartilage damage, and it gives us the complete picture of cartilage, how badly are injured, how smaller the injury to the cartilage. So the cartilage nutrition is the most important, which is supplied from the synovial membrane and then the vasculature around the joint. The cartilage, like anywhere, even in the any joint, it will surfaces the bone ends. When bone ends are covered with the cartilage, during the friction in between the two joints, the cartilage will give you a smoother ability to walk, and it will help you to avoid any pain. So the cartilage is the most important part of the joint, where the joint life will be depends on it. So obviously when there is a cartilage injury, there is a patchy cartilage injury, there are the modes of treatment we can treat the patient. So for example, stage 1 cartilage damage, it's an early stage where advising few medicines and then the regenerative medicines which helps you to regenerate the cartilage. When the cartilage is in a patchy mannered damage, then we can inject the hyaluronate injections which regenerate the cartilage. Otherwise, we can inject the PRPs into the patchy damage to the cartilage, where we can regenerate the cartilage. If not, then ultimately if total cartilage is eroded, and then if there is a damage to the hard bone, there is a deformity, then we must do a total replacement in stage 4 damage to the joint. So in this section, the cartilage is the most important part of the joint, which is the most active and very important part of the joint, where we should take care of in a proper channel, so that the person does not suffer from a joint pain or any other problems.